Welcome back, everyone, to the Deep Dive. Today, we're going to be taking a look at Rebel Health by Susannah Fox.
Yeah.
And, this is really a book about,
Yeah.
how people are finding strength and new ideas in each other,
It's fascinating.
especially, when they're facing, health challenges.
That's exactly right.
And so for our listeners out there who are, looking to kind of get smart
Yeah,
quickly on important topics,
for sure.
we're going to really try to distill this down
Absolutely.
to like the key insights.
Yeah.
And hopefully bring out some maybe surprising things
Yeah.
without like totally overwhelming you with all
Right.
the detail.
Absolutely. I mean, what's so fascinating about this book is it really showcases the power of individuals.
Yeah,
And I think particularly, when you're facing a health issue,
right.
often, that brings people together in ways that,
Yeah,
they naturally share what they know.
yeah,
They support each other, and a lot of cases it drives innovation in ways that traditional healthcare systems maybe miss out on.
yeah, exactly. Rebel Health is really chock full of stories
It is.
about patients,
Yeah.
caregivers, and kind of the amazing things that happen when they connect.
It's powerful.
And so, yeah, in this deep dive, we're really trying to grasp,
Yeah.
why these peer-led health movements
Yeah.
are so vital and what kind of impact they're having.
I think if we sort of take a step back and think about this historically,
Right.
it's clear that long before the internet,
Yeah.
people relied on their communities for health wisdom.
Yeah.
Your neighbors, your
Yeah.
family,
Right.
those were the first people you turned to when you had a question about your health, or you just wanted,
For sure.
to know you weren't alone
Absolutely.
in dealing with something.
But, the last century brought a big shift,
It did.
didn't it? With
Yeah.
kind of the medical world becoming
Yeah.
much more professionalized and healthcare kind of moving out of the home in a lot of ways,
Yeah.
which, kind of pushed
Well,
aside
in some ways.
some of that knowledge that
Yeah.
everyday people held.
Yeah.
And just to give you an example of that, around 1900,
Wow.
a full 95% of births happened at home.
That's incredible.
And now that's totally flipped to like 98% taking place in hospitals.
Really
So,
wild.
this professionalization of healthcare,
Yeah.
while it's brought so many advancements,
Of course.
it also inadvertently disconnected people from,
Wow.
these traditional sources of knowledge and support.
Yeah, that makes sense.
And it wasn't just about where babies were born.
Right.
Rebel Health actually points out that
Yeah.
deaths in institutions like hospitals rose dramatically,
Yeah.
from 50% in 1949 to 74% by 1980.
Wow.
So you really see that shift towards, healthcare happening
Yeah.
in these institutions.
It's interesting, though. I mean, recently
Hmm.
we've seen this surge in home deaths, actually surpassing hospital deaths for the first time since the early 20th century.
Right.
So, it's almost like we're seeing a little bit of a swing back
Yeah.
alongside these advancements in medicine.
Right. It's like things are kind of circling back in a way.
Yeah, for sure.
But one thing that's undeniably different now
Yeah.
is just this mountain of medical information
Oh, yeah.
that's out there. Back in 1976, there were something like 700
Wow.
medical journals in the U.S.
Mm.
Today, the National Library of Medicine indexes something like 30,000.
It's overwhelming.
It's absolutely impossible to keep up with.
Absolutely.
And so, the book really talks about how, that explosion of information,
Yeah.
makes it virtually impossible for anyone, especially
Yeah.
someone dealing with a health issue,
Yeah.
to really keep up
Yeah.
and to like master all of it.
Right. You need help.
Yeah.
You need a community.
And so, that kind of
Yeah.
creates this gap, right?
It does.
When you have this information overload, and sometimes
Mm-hmm.
traditional healthcare isn't quite meeting people's needs.
Right.
And I think what Rebel Health
Yeah.
really emphasizes is, that human need to connect with others
It's powerful.
is so strong.
Yeah.
And so when those gaps appear,
Yeah.
people naturally look to each other
Absolutely.
for understanding and support.
Community is a superpower.
Yeah. And that's really what this is all about. So,
Yeah.
who are the people that are
Yeah.
kind of leading this charge? Well, the book introduces this concept of seekers, right?
Seekers. Okay.
These individuals who are actively looking for information support
Yeah.
and real answers.
Hmm.
And this is where it gets really interesting.
Okay.
One of the examples that's given in the book
Hmm.
is this guy, Bert Minnow, who was born way back in 1922
Okay.
with Mobius syndrome, which is this rare neurological disorder. And he, for decades, He and his family didn't even really know what it was.
Mm.
And so, it's really interesting to consider like his experience.
What's striking about Bert's story
Yeah.
is that, the profound isolation that
Yeah.
comes with a condition like that. I mean, he
wow.
lived without a diagnosis for so many years.
Yeah.
Even something as basic as communication
Yeah.
was a real challenge because, he couldn't move his lips to speak clearly.
Wow.
And it wasn't really until very late in his life that
Right.
the internet provided this crucial lifeline for him.
Right. In that last year, he finally found, a community of other people
Mm.
online who had Mobius syndrome.
Mm.
And his niece, described him as becoming the elder statesman
Wow.
of this very small but very excited community.
Mm.
And it was all thanks to the web.
That's amazing.
And it just makes you think, right,
It does.
about how
Yeah.
sometimes that hope itself
Yeah.
can be as meaningful as a cure
Absolutely.
when you felt completely alone with something
Yeah.
for so long.
Sure.
And, this need to connect isn't just for folks with these rare conditions.
That's right.
Rebel Health points out that even for common chronic conditions,
Yeah.
which affect something like 6 in 10 U.S. adults,
It's a lot of people.
it's huge.
Yeah.
Peer support is absolutely essential.
It makes sense.
And there's just this, fundamental desire, I think, to connect with others who just get it, who
Yeah.
truly understand.
Empathy. Yeah.
Yeah, that feeling of, I'm here, I
Yeah.
see you.
Absolutely.
And, a really clear example of this is, if we look at the RSTD subreddit,
Oh, interesting.
between 2010 and 2019, there were almost 17,000 posts,
Wow.
and an incredible 87%
That's a lot.
of the posts that were requesting, like a kind of crowdsourced diagnosis,
Right.
actually received replies. And a lot of times those replies
Mm-hmm.
came in a median time of just 3 hours.
Wow. So fast.
So fast, which I think really shows that,
Yeah.
there's this really intense demand for immediate peer-based information,
For sure.
when people are dealing with them, maybe sensitive or urgent
Yeah.
health concerns that they might not feel comfortable
Right.
bringing up elsewhere.
Absolutely. And this ties into what the book talks about is that,
Yeah.
3 a.m. Dr. Google consult,
Right.
that classic seeker behavior
Yes.
where, it often happens when our needs feel unmet.
Yes.
They're invisible to public health agencies. And, we're up late at night,
Right?
anxious,
Yeah.
searching for answers.
Have you ever been there,
Of course.
Yeah.
Late at night.
Yeah.
Googling
Yeah.
medical symptoms.
Trying to figure it out.
Yeah, yeah.
And, the book really emphasizes that.
Yeah.
The power of finding even just one other person
That's all it takes.
like you is so huge
For sure.
because suddenly you're not navigating this,
Mm,
often very confusing healthcare
know.
system totally on your own.
absolutely.
You can kind of pool your knowledge. You can share what you've learned.
Yeah.
You can feel less,
Support each other.
less lost in this maze.
Exactly. And, we see that really clearly in the book with Alder's experience with post-orgasmic illness syndrome or post-love.
Yeah.
I mean, he searched for answers for 7 years.
7 years.
Often being told that it was psychological.
Oh, wow.
And imagine the relief
Yeah.
when he finally found a research paper that described poise
Right.
and was able to connect with an online community
Yeah.
of other people who understood what he was going through.
Wow. It's like going from feeling totally broken
Right.
to, finally having,
Feeling seen.
a diagnosis
Yeah.
and a community.
Yeah.
It's really powerful.
Really powerful.
And, one thing the book touches on
Yeah.
that I think is interesting is, this kind of missed opportunity in the early days of the internet where, medical professionals were really focused on this kind of one-way education model,
Right.
pushing information out to patients.
Just lecturing.
Yeah, rather than really listening to
Yeah.
what was happening in these emerging patient communities.
Right.
And, all the knowledge and experiences
Absolutely.
that those folks had.
Yeah.
So, that's kind of like the seeker journey.
The seekers. Okay.
Right. But then, we get into these tactics and the courage it takes. And the book talks about these home health hacks.
Home health hacks. Okay. Interesting.
Like these ingenious everyday solutions that people come up with.
Yeah.
And one example is, Delina Price McFall. She was trying to find a better way for her brother-in-law who had Parkinson's
Oh.
to manage his pills.
Yeah.
Which are often tiny.
Right.
and difficult to handle. And so she was looking for these creative fixes.
I see.
And that really ties into this
Actually,
idea of the rebel health matrix.
The rebel health matrix.
Which is, it's a way of understanding, visibility and unmet needs.
Okay.
So you've got one axis that's about how visible a condition is.
Yeah.
And then you've got another axis.
Yeah.
That's about how well the needs are being met.
Okay.
By the system.
Yeah.
And so, you've got people who are in this, like, you look fine purgatory.
Oh, been there.
Right.
Yeah.
Where it's not obvious.
Invisible illness.
Yeah.
Yeah.
Or you've got folks who are completely unseen.
Yeah.
And ignored by mainstream healthcare.
Right.
And so, it's really interesting to think about that matrix.
Yeah.
And where different conditions fall.
Absolutely.
And then, one of the things that the book points out is how, seemingly ordinary platforms can become these, like, really vital hubs for peer health advice.
Right.
And one of the examples that's given is online reviews.
Oh, okay.
Like, think about Amazon reviews.
Right. Everybody looks at those.
Right.
Yeah.
The sheer number of reviews for everyday health-related items.
Mm-hmm.
Things like pill boxes, reading glasses, gas relief troughs, blood pressure monitors. It represents this massive informal exchange of tips and experiences.
Yeah.
Between people who are using those products.
It's like these little spontaneous communities.
Yeah.
Yeah.
And, sometimes just takes one person to really speak out about their experience.
Yeah.
To create this huge wave of change.
That's right.
And the example that the book gives is Sorrel King.
Yeah.
And her advocacy after her daughter Josie died due to medical errors.
That's awful.
She didn't just want to evoke sympathy. She really actively demanded action for patient safety.
I can understand that.
And that led directly to, initiatives like Condition H.
Condition H.
Which is this program that's been implemented in a lot of hospitals.
Mm-hmm.
That allows patients and their families to actually trigger a rapid response team.
Wow.
If they're observing, a concerning decline in the patient's condition.
So it's kind of like empowering the people who are closest to the situation to say, hey, something's wrong here.
It's recognizing that. The people who are closest to the patient often have the most valuable insights into what's really going on.
That's powerful.
And, the book shares the story of this Dr. Jonathan Welch and his mom.
Okay.
He was a medical professional himself.
Right.
And he actually watched, as you know, the chance to effectively treat his mom's severe infection kind of slipped away.
Wow.
And partly, he was hesitant.
Yeah.
To kind of overstep or offend the clinicians who were treating him.
Hard when it's your own family member.
Yeah. And so it makes, Heiger Hagen's use of Condition H to save her mom's life.
Oh, wow.
After an incorrect diagnosis. Even more powerful.
That's amazing. So she was able to.
She saw Dr. Welch's tweet
wow.
about his experience. And, she realized, hey, I need to use this Condition H to save my own mom.
That's incredible.
And so, she really moved from a place where her mom's needs were unmet and unseen to, getting the help that her mom needed.
Wow. It's like...
It's amazing, right?
It is. It's like these small online connections can have these huge real-world consequences, and we often don't even realize it.
Right. And it's important to remember, even before the internet, these seekers were out there.
Absolutely.
The book talks about Vicki McCarroll and her search for information about Mobius syndrome for her son.
Yeah.
Way before the internet existed.
Wow.
And so
these seekers have always been out there.
Right. They've always been there.
Yeah.
So now let's talk about networkers.
Get the networkers?
These are the folks who are building these crucial communities.
Yeah.
And diligently sharing knowledge.
I love that.
And initially, there was actually a lot of concern from clinicians about these online patient communities that were operating without
supervision.
Yeah, without professional oversight.
Interesting.
And even the American Medical Association
AMA
famously suggested back in 2001 that people should trust your physician, not a chat room.
Oh, wow.
And so, despite that kind of skepticism from the medical establishment, these online communities not only persisted,
they did,
but they continued to grow.
Yeah.
And actually, research has shown that
Interesting.
there is real value in these communities.
Okay.
So, for instance, a study that looked at an ICD patient message board,
ICD, okay.
implantable cardioverter defibrillator,
Yeah.
found that about half
Wow.
of the advice that was shared was either benign or actually helpful.
So it was at least not harmful.
Right. And similarly, a study of a diabetes online community
Okay.
showed that nearly 40% of members felt like they were helped by the advice they found there.
Okay.
And 99% said
Wow.
that they experienced no harm.
That's really interesting.
So I think it
Yeah.
really, kind of changes how we should think about
Right.
these online health communities.
That is not just people chatting.
They're not just casual chat spaces. Rebel Health refers to them as this: information market opportunity, which I think is really interesting.
Yeah.
And something that we should really be understanding
Absolutely.
and supporting. And I think, we saw this really clearly with the formation of the online support groups
Yeah.
for people experiencing long COVID,
Right.
things like Body Politic,
Yeah.
Survivor Core.
Those were really helpful for a lot of people.
Yeah, and they were able to.
And they were able to bring this
Yeah.
issue to the attention of, major health organizations.
Like the WHO.
Like the WHO, the CDC, the NIH.
Right.
All of a sudden it was on the radar.
Yeah. And they really, these networkers,
Yeah.
they help increase the visibility of both the problems
Yeah.
and potential solutions.
That's so important to
Yeah.
kind of get it out of that
Yeah.
no clue, not connected space and into a place where you can get science-backed advice and see a clinician if you need to.
Yeah. And Rebel Health uses the example of managing diabetes
Okay.
to really highlight this need for ongoing support and decision-making.
Okay.
And it's not just about the medical
What is
aspect.
it, a lifestyle?
It's behavioral.
Yeah.
Yeah.
And so, this is where Amy Tendericks, creation of diabetes brand,
Yeah.
really comes in. She was a seeker herself.
Okay.
And she essentially built the resource that she wished she had.
Wow, that's amazing.
Yeah. And so that
peer support is recognized as essential for managing all sorts of chronic conditions.
Yes.
Diabetes, eating disorders, mental health, you name it.
Yeah. And even
And it's interesting because the cost of traditional treatment can be so high for something like eating disorders.
right
And it turns out that fares your mentors.
are a really important part of successful recovery.
Yeah, and even, CMS, the Centers for Medicare and Medicaid Services,
Wow.
recognizes peer support as an effective intervention
Yeah.
for mental health.
That's huge.
And, that I actually have programs utilizing recovery mentors
Yeah.
that have shown significant reductions in hospital admissions.
That's incredible.
And, I love Dave DeBroncart's story
Yeah, what happened there?
about, his experience with kidney cancer. Because, he was given this recommendation to connect with other patients.
Okay.
And that led him to crucial information
Yeah.
about a life-saving treatment
Yeah.
that he was already receiving.
Wow.
But he didn't even realize
Yeah.
the significance of,
So he was already getting it.
and it was because
Yeah.
the information that he had access to
Yeah.
was actually outdated.
Wow.
And so,
It's so important to
That's something-
connect with other people who have that lived experience.
and I think, sometimes networkers have to overcome
It's hard to talk to strangers.
that initial,
Yeah. Especially online.
discomfort of talking to strangers. And
But often we underestimate both what we could learn and how willing people are to help.
exactly. And I think it's also important to, point out that it's not just about finding any community.
Right.
Right.
You got to find the right community.
Yeah, you need to find the right community for you.
That makes sense.
And, the book talks about Liz Salmi's experience, who, joined a general cancer support group. But then she found it much more helpful to connect with a group that was specifically for people with brain cancer.